Human Immunodeficiency Virus (HIV) by Megan Bates. Our immune system contains a network of cells, organs, and proteins that work together to defend our body from harmful microorganisms. Some microorganisms could be bacteria, viruses, parasites, and fungi. One type of virus is the human immunodeficiency virus, or HIV, which has caused an outbreak in time. HIV continues to be a major global public health issue among the United States and other countries. According to the World Health Organization 2020, HIV has thus far claimed the lives of 34.7 million people. HIV is considered a viral infection that targets one immune system. HIV is a member of the retrovirid family, and there are two known strains, HIV-1 and HIV-2, according to the HIV Agent Information Sheet. Furthermore, HIV can lead to the acquired immune deficiency syndrome, or AIDS, over time if it is left untreated. According to the CDC, HIV destroys the CD4 plus T blood cells, which are crucial to helping the body fight diseases. Due to these blood cells being destroyed, this will result in a weakened immune system, making those diagnosed with HIV more susceptible to different types of infections. HIV is transmitted through sexual intercourse through mucosal surfaces, maternal infant exposure, and precursionist inoculation. HIV is also spread by coming into direct transmission with a certain body fluids from a person with HIV. Some of the ways these fluids can spread is through blood, semen, vaginal fluids, breast milk, and rectal fluids. Additionally, for transmission to occur, the fluids must go through the bloodstream of an HIV-negative individual through a mucous membrane, open cuts or sores, or by direct injection. According to Pawlowski, Matthews et al. 2013, in order for HIV transmission to occur, the virus must have direct contact with cells that are susceptible to infection, mainly those cells that carry the specific surface membrane molecules to which the virus attaches and thereby infects the host cell. So, as with anything, there are the most common and the most rare forms of HIV being transmitted. Some of the most common ways to spread HIV, according to the CDC, is by sharing injection drug equipment such as needles and having vaginal or anal sex with someone who is positive for HIV without using protection. Less common ways HIV is spread includes during pregnancy, birth, or breastfeeding from the mother to the child. This activity is becoming less common as the use of HIV medicines have helped to lower the risk of mother-to-child transmission to 1% or less in the United States. Getting stuck with an HIV-contaminated needle or other sharp objects. This is a low risk for healthcare workers. Finally, there are some extremely rare cases that HIV can be transmitted. First, having oral sex. It has been found to be very low that an HIV negative person will contract HIV from an HIV positive partner. Second, receiving blood transfusions, blood products, organs, tissues, transplants that are contaminated with HIV. This risk is extremely low due to the United States' rigorous testing of donated organs, tissues, and blood supply. Third, being bitten by a person with HIV, as there is no risk of transmission if the skin is not broken. Fourth, contact between the broken skin, wounds, or mucous membranes of HIV-infected blood or blood-contaminated body fluids. Fifth, deep open-mouth kissing if both partners have sores or bleeding gums and blood from the HIV-positive partner gets into the bloodstream of the HIV-negative partner. HIV is not spread through saliva. And finally, eating food that has been pre-chewed by a person with HIV. The contamination occurs when infected blood from a caregiver's mouth mixes with food while chewing. The only known cases are among infants. HIV is zootonic in nature. Scientists believe HIV was originally carried from chimpanzees. When hunters hunted chimpanzees for food, they would become infected with a mutated form of the virus upon contact with the blood of the chimpanzees. In Africa, HIV jumped from chimpanzees to humans sometimes early in the 20th century. In 1959, a sample of blood was taken from a man who died in the Belgian Congo. This is known as the earliest case of HIV-1. Individual risk factors of HIV. HIV infection is defined more by a person's sexual network than by their individual behaviors. According to Pawlowski, Matthews et al. 2013, poverty, discrimination, inequality, and other social conditions facilitate HIV transmission. Also, substance use can both reduce the likelihood that a person will take protective actions, such as using condoms, and substance use can stimulate HIV replication and therefore increase infectiousness. Additionally, relationship instability caused by economic stress, stigma, discrimination, domestic violence, migration, and incarceration can also assist in contributing to sexual partners' mixed patterns that foster HIV transmission. Access to health care offers the potential to alleviate multiple sources of HIV transmission risk by reducing infectiousness through antiviral therapy and decreasing susceptibility through mental health, substance use, and STI treatment. According to the CDC in 2019, only 58 cases of confirmed occupational HIV transmission to healthcare personnel have been reported in the United States. An additional 150 possible transmissions have also been reported to the CDC. Environmental factors and environmental barriers have been identified, which include hassle of getting care, negative provider-patient relationships, and societal attitudes and funding for care, according to Nichols in 2009. Transportation and poverty have also been an environmental factor inhibiting successful HIV treatment. Finally, social barriers identified, including caregiver responsibilities, fear of stigma, discrimination, and disclosure concerns, have played a part in the environmental factor of HIV. There are also HIV reservoirs that can impact the cure of HIV. Cellular reservoirs that contain latent HIV is a major barrier to HIV eradication or occur. These reservoirs are HIV-1 infected cells of the immune system that, under the pressure of antivirals, do not actively produce a new virus. As soon as the antiviral therapy is discontinued, the virus starts to replicate again. If left untreated, this could turn into AIDS. To conclude, HIV can only live inside the body. HIV can only be spread through intimate contact between an infected person and an uninfected person. HIV is passed to another person only when blood, semen, vaginal fluids, or breast milk get into the unaffected person's body.